Hello everyone, how are you doing? This is Mikva Clinic by Dr. K. Today we are going to revise pneumonia in pediatrics. I have prepared this video based on the following references. The first one is Nelson Pediatrics 21st edition. The second one is WHO Pocket Book of Hospital Care for Children, 2nd edition. Pediatrics Hospital Care of Ethiopia, 2nd edition. MedStar Pediatrics 2nd edition, Farmos Pediatrics 1st edition, Dream Pediatrics 1st edition, Pediatrics and Child Health for Health Science Students, Lecture Note 1st edition. So we will summarize all the information about pneumonia in pediatrics age group, which means the definition, etiology, epidemiology, clinical manifestation, investigation, management, complication, and prognosis from all these books. So you are not obliged to read all these books. By simply watching this video, you can get adequate information about pneumonia in pediatrics age group.
When do we admit a child presented with pneumonia? One is the presence of severe pneumonia. The second one is the presence of any complications of pneumonia like parapneumonic effusion, empyema, pneumothorax, or septic infections like meningitis, infected endocarditis, dermatitis, and the like. And a child positive child, without the presence of any severity feature, we have to admit a child who is child positive and developing pneumonia should always be admitted. The other thing is age less than 6 months and social factors, especially for children who don't have any guardians or parents. For this reason, we may admit a child to the hospital. So these are some of the admission criteria for a child presented with pneumonia. And finally, complications of pneumonia. Complications of pneumonia can be classified as local complication and systemic complication. From local complication of pneumonia, one is pleural effusion, which is parapneumonic effusion or empyema. And the other thing is lung abscess. The other thing is pneumothorax. And the other thing is Staph aureus pneumonia is by itself, it's complicated, especially when we suspect Staph aureus. The management also should be modified. The first line treatment for considering Staph aureus pneumonia is fluoxacillin 50 mg per kg in QID base and gentamicin 7.5 mg per kg daily, IV or IM. So this is the way how we treat Staph aureus pneumonia. If he is improved, then we can change the fluoxacillin to PO for 3 weeks treatment. So these are some of the local complications of pneumonia, and the systemic complications are septic infections, starting with the blood infection causing sepsis, or infection of the heart like causing infective endocarditis, the kidney, pyelonephritis, the joint septic arthritis, the bone osteomyelitis, the central nervous system, meningitis. So all these systemic complications can occur due to pneumonia. These are the complications of pneumonia. Whenever there is complication, they have separate management and diagnosis. We will discuss those complications under surgical aspects of pneumonia. So these are some of the complications that we should know while managing and diagnosing and managing pneumonia. Finally, the prognosis of pneumonia. The prognosis, we will expect clinical resolution or improvement within 48 to 96 hours. Within the first 2 up to 4 days, the child should clinically improve with our antibiotics treatment. If he is not improved, what should we consider? Always start with the adherence of the patient to the drug, whether he is appropriately taking the medications you prescribed. If he is not taking, we don't expect improvement. So we have to assess whether he is taking the medications, and if he is taking, whether he is taking the appropriate dose of the medications. This is one thing. The second one is we have to check whether our diagnosis is appropriate, which means we have to reevaluate the child. We have to make sure that the diagnosis is right. And the third thing is the diagnosis might be right, but the etiologic agents may not be covered by the antibiotics that we provide. So etiologic agents might not be covered by the drug that we provided. So the etiology, the diagnosis is right, but the etiologic is wrong. The fourth one is the diagnosis is right, the etiologic agent is right, but that etiologic agent may develop resistance to the antibiotics that we provide. So doing drug sensitivity tests from blood culture and the like is advised. So resistant to antibiotics is for the cause for lack of improvement. And the fifth one is due to the development of complications, which means a child who has already developed empyema, providing whatever IV antibiotics or pure antibiotics will not result in improvement. So the presence of any complications of pneumonia should be assessed. So these are among the major causes for a child not responding to antibiotics treatment. Whenever we get these features, then we have to search for these causes of lack of response to treatment. And the physical findings may not disappear immediately, and the chest x-ray findings may even stay up to 3 months. So what we have to see is the clinical improvement is expected in the first 2 days. This is how we assess the prognosis or the progress of the child after treatment. If we say this much about the prognosis, finally, how do we prevent? Prevention of pneumonia. It's straightforward. Avoiding those risk factors. One and most important thing that I want to tell you under prevention is immunization. So any child who is not immunized and came to you with pneumonia, you have to start, the child should start catch-up vaccination. And vaccination for influenza virus is advised for children above 6 months of age. Actually, it's not being provided in our country. Vaccination for syncytial virus is under investigation, but common cause of pneumonia like pneumococcal or streptococcus pneumonia vaccination is prepared as PCV13, covering almost 13 strains of streptococcus. So getting the vaccination for H influenza type B reduce the risk of developing pneumonia. So vaccination is the most important thing in preventions of pneumonia, and avoiding all the risk factors that I have listed in our discussion should be given special attention. So this is the way how we prevent pneumonia. Finally, let me give you a differential diagnosis for acute cough, and you have to work out or you have to read in detail about this disease entity so you can easily rule out each of them. A child presented with acute cough. Top differential diagnosis, one is pneumonia, but we should consider all these other differentials like foreign body aspiration. You have to ask the child whether he had any choking episodes. It's very suggestive history for foreign body aspiration. Then we have to investigate with chest x-ray. We may directly see that foreign body on the chest x-ray. The other thing is reactive airway disease. Usually it is associated with diffuse wheeze in addition to the cough, and other atopy can be seen. And the fourth one is bronchiolitis. The same is true, especially for children. It occurs on children less than 2 years. We don't expect bronchiolitis after that age, and usually they will have diffuse wheeze, and they will have sometimes may have toxic features. The other thing is croup is also another common presentation of commonly present with acute cough, but the typical presentation is stridor, and other additional features should be assessed. Exacerbation of asthma, heart failure, so all these things should be ruled out. Bacterial tracheitis, tracheoesophageal fistula, or sometimes drug-induced, especially children taking ACE inhibitors, especially a child with heart failure, hypertension. This group of drugs might be prescribed and they may cause dry cough. because of the release of this, what we call it, bradykinin. And common cold is also a common cause of acute cough. It's self-limiting. By reassuring the family, we may send them home, because in common cold they will not have toxic symptoms or systemic manifestations like fever, rhinitis, and sometimes sinusitis. All these conditions may result in acute cough. So, considering all these differential diagnoses, we have to diagnose pneumonia considering all these differential diagnoses. I hope you get the detailed information about pneumonia in pediatrics age group.